Hey guys, Dr. Will from Miami Spine and Performance. Today's part 5 of our summer series. So this last part of the series, I want to give you guys some pointers on when to know kind of what tool might be appropriate for you, whether you're coming here or whether you're going to another provider. When should I get an adjustment versus when would something like maybe dry needling be effective versus when do I need shockwave therapy? So I'll tell you the primary use for each of these tools so you know kind of when this tool is appropriate for you. So chiropractic adjustments focus on moving joints and restoring mobility, specifically to the spine, but also many chiropractors, including myself, do adjustments on the shoulder, on the feet, on the hips. So if you're starting to feel stiffness in the joints, meaning that I'm not talking about a tight muscle, but stiff, you bend over to touch your toes and your back just kind of aches, or you look behind you and you feel like your neck is just kind of stuck, or you're having trouble extending your elbow, you're probably due for a chiropractic adjustment. And so that would be an appropriate time to come in, get adjusted. Typically with a new patient, we'll start out with 5 or 6 adjustments over the first few weeks, and then we'll kind of, spread them out depending on each person's goal and time availability and things like that. Something like dry needling is going to be more effective for if you have something called trigger points. Okay, so if you have, let's say, little points in your traps where you can push on a point and it feels really, really sore, or you feel it shoot up to your head, or it gives you a headache, or you push on your calf and you feel there's almost like little balls in your calf that when you push on them it feels really, really sore. That's a time when probably you're going to respond best to dry needling. Dry needling can be super, super effective for upper trap tightness, sciatica, tennis elbow, wrist pain, plantar fasciitis. So if you're feeling any of those things and you're feeling, again, specific like points, like you could say, Doc, my elbow hurts right here. I can feel a bump where it hurts. Dry needling is probably the right tool for you. Now, if you're dealing with a chronic overuse injury, so let's say that every time you play tennis, you get out there and your Achilles just starts to ache, or you start to feel your shins a little bit, or when you go to the gym, your shoulder just doesn't feel right. It doesn't feel stable. You feel a lot of achiness and discomfort when you're doing overhead pressing and benching. This is a sign that the tissue itself is probably not healthy. You either have scar tissue in there, you have tissue that's damaged, or you have tissue that's inflamed. And so shockwave therapy is likely the best therapeutic for you. Now, of course, if you're somebody that is experiencing all 3 of these, a treatment plan including all 3 is very, very possible. But these are some really, really good tools that we use in manual medicine. And I just want to give you guys kind of some insight into what type of tool is appropriate for what type of case. So thank you guys for watching. I hope you enjoyed the 5-part summer series. Let me know in the comments what you guys would like to see next. Thanks for watching, and I'll see you next time.